With college comes certain responsibilities as we become young adults. As students, we have to adjust to being on our own and the everyday temptations that come with a college lifestyle. One of the most common temptations we face on a regular basis deals with sex. In college, majority of students are sexually active and use this time in their life as an excuse to learn who they are as a person. With that risk comes the possibility of pregnancy or even STDs. With the rise of pregnancy or sexually transmitted diseases in teens and young adults, many people are questioning, should we make it easier for younger people to get certain vitamins such as birth control? Or should insurance companies allow free birth control? Here's a superstar panel of doctors from the hit talk show Doctors discussing the topic.
We're talking about in the last 2 years, not since the advent of birth control.
But it's not related to birth control.
But since 1965?
My point is,
that's insane.
Is a human
let's clarify.
basic right.
You're talking about some tiny little dip last year. Do not contradict me and then confuse the facts. Since birth control was introduced 30 years ago, unwanted pregnancies and abortion have gone through the roof.
Some younger people, and women at that, feel as if birth control can prevent pregnancy and the transfer of sexual diseases, which is a false assumption. Dr. Natasha Dormina explains how younger women misunderstand the concept of birth control.
Yeah, they often think that, and then they also think because they don't have symptoms or their partner doesn't have symptoms that there isn't any cause for concern. But there's a lot of common STDs that don't have symptoms. For instance, chlamydia, herpes, HIV, none of these things have symptoms.
In Hampton, Virginia, we have one of the highest STD rates of the Tidewater region. Being said, safe sex is a must. The Hampton Roads area has the second highest rate of chlamydia infection cases and the third highest rate of gonorrhea cases. Here is Dr. Brian Bowers to speak about that.
Virginia is actually prevalent for STDs. Main reasons for combination of two factors. You have a lot of colleges in this area, ODU, NSU, and HU, along with the military, and that plays a big role because people are deployed in various parts of the world, and they have their fun, they come back and do their thing. Of course, with any college campus, doesn't matter if it's a HBCU or another institution, STD rates tend to be higher, and that mainly has to do with young adults, making brash decisions, get caught up in the moment, and don't use protection, and with that, young adults usually don't get tested the way they should.
10% of people infected with HIV or AIDS in the state of Virginia live in Norfolk, making it the city or county with the second highest percentage of people living with this disease. Newport News is tied with Virginia Beach for the third highest percentage of diagnosed cases of chlamydia. With these drastic numbers, the practice of safe sex is a must in Virginia. This is Dorian Walker with Jack 440.